Welcome to Derm Clarity, Poor Decisions and Flake News. I'm Erica Ramos. I've spent over 21 years in healthcare. I'm a dermatology physician associate, doctorate of medical science, the founder of Restorascalp, and the host of this podcast. I'm here to help you make sense of your skin without the hype. Just a quick note before we dive in. This podcast is for education only. It's not medical advice, and it doesn't replace the care you receive from your own provider. My goal is simple: to help you understand what's happening with your skin, hair, and nails, so you can make informed, confident decisions alongside your care team. Welcome to Derm Clarity, Poor Decisions and Flake News. And we're digging our nails into Manny mysteries. What are your nails saying to you? Because your nails are not just there to hold polish. They are tiny little billboards, and sometimes they're oversharing. I cannot think of a better person to talk nails with than my guest today, Shanna Miranti. She's one of my most favorite dermatology PAs. She has over 23 years of clinical experience practicing in both Jacksonville and Naples, Florida. She's someone who's seen it all and is deeply committed to advancing dermatologic education. She's passionate about advocating for the PA profession. She's taken on many leadership roles as a PA, is an editor for the Journal of Dermatology for NPs and PAs, is the founder of the Southwest Florida APP Society, the co-host of Skin Sync podcast, and a lecturer at many conferences. Whew! I don't know if I could add anything more to that. Yeah.
And the mother of 4 children in my
And a
spare
mother of 4
time.
children,
That's the other thing I always add in.
running them in all different directions. So
Totally.
basically, though she eats, drinks, and breathes dermatology, Shanna, thanks so much for joining me today.
Erica, I'm so excited to be here. This is amazing. I love talking skin. I love talking nails. I love talking dermatology topics. I love derm podcasts. Well, I was a guest on a couple of podcasts a while back, and I was like, what a great idea. And then was asked to co-host a podcast along with the fabulous Buccinita, who's a derm PA out of Atlanta, Georgia. And I have had such a blast we've only been really recording for about 6 to 9 months. Maybe it has been, a totally new journey for me, but so much fun and such a great way to connect with colleagues about something that we all love and about something we're all really passionate about.
So today we're going to talk about, why do the nails matter? What are they telling us? Because a lot of people think that nails are just cosmetic. That's what we put our nail polishes on, right?
Right. It's
So,
not just a hanger on which to hang your clothes. Nails truly can tell us so much about a patient.
mhm.
They can tell us about a patient's health, their nutrition, their hydration, their overall physical body chemistry. It's amazing what a good provider can see through a person's skin quality and their nail quality. And as you know, dermatology is the study of skin, hair, and nails, but the least understood is probably the nails.
And sometimes it'll even give us a timeline of when something happened.
Very
They'll
true.
they'll look at you and go, "How do you know it was 3 months ago?"
Right, exactly, exactly. Yeah. Almost like the rings of a tree, right? So
Yeah.
most providers learn that nails will grow at very predictable increments unless a patient is, incredibly unhealthy or has severe nutritional deficits, or is on medication that can thwart that growth. Typically, a normal fingernail is going to take about 6 months, maybe 6 months plus to replace itself. Toenails can take 12 months, sometimes 12 to 18 months. So when I see a person with a subungual hematoma, right smack dab in the middle of their great toenail, I say, what did you drop on your toenail 6 months ago? And they're like,
Yep.
how did you know it was 6 months ago? That's always a fun trick.
So what's your approach when you're looking at somebody's nails to evaluating it? What kind of questions are you asking the patient?
Yeah. So I use dermoscopy, of course, like a lot of us do. So dermoscopy is the study of a specific, way to evaluate skin, hair, and nails using a dermatoscope. I often say it's my little like inspector gadget tool, and it's going to give me magnification, but also it's going to give me some different light sources. There's usually polarized, non-polarized light, sometimes a UV light or black light that we can shine on different surfaces, and we can use it directly on skin or nails, and we're able to really kind of get down in there and see some very specific structures that we can't always see with the naked eye. In the nails, it's really interesting because it can point out colors that look different with the naked eye. Purple color can sometimes look very black, and it can sometimes look
Yes.
dark brown.
People
And
can get
patients
really nervous about it, and you're like, "Oh, it's just blood splatter."
Exactly. Patients get very nervous that they have a melanoma of their nail, or they have some weird new melanocytic process that just popped up. And no, it's just dried blood under the nail. And we can tell that very easily with dermoscopies.
So from a nail perspective, let's first talk about ridges, lines, and texture. So there's different textures, I would say. A lot of people come in mainly worrying about one of the least concerning ones, which are these little lines that we get, and I kind of think of them as the wrinkles on our skin.
Right. That's a great way to put it. So, onychorexis, onychoschizia, there's a lot of big, crazy names that you'll see on the
Yeah.
internet or that ChatGPT will spit out for you when you're asking about nail conditions. But a lot of times, our nails will just show dryness in different patterns, right? So, just as our skin can get dry and can get wrinkles, our nails can get very dry and can get ridges. So, our nails are essentially, if you look at nail anatomy, it's basically multiple, like probably about 100 layers of compact keratin or flat dead keratin cells that are all tightly, tightly packed together, but they're so thin that they almost create this like multiple spider webs kind of on top of each other. And nails are very hydrophilic. They love water. So they will love to kind of suck in hydration from the outside in and also from the inside out. So if patients are well hydrated from within, their nails will often retain that hydration. When patients get dehydrated due to multiple different conditions or multiple different inflammatory conditions, autoimmune conditions, the nails can get very dry and can often see those longitudinal ridges or ridging of the nail.
You talked about inflammation. Sometimes we'll look like a woodpecker kind of went to our nails, and
Right.
sometimes that could be an indication of inflammation.
Very true. So nail pitting or like the little pits and little kind of dings, but I'm gonna call it a little woodpecker.
Woodpeckers.
Like I love that. That's a good description. Nail pits can often show signs of psoriasis. That can sometimes be one of the first signs that a patient could have psoriatic disease of the nails. Sometimes we'll see discolorations like oil spots and other nail findings in our psoriasis patients. But for all the providers out there that are listening, don't discount a diagnosis just because you don't see that nail finding. It's
Mhm.
not going to be in 100% of your patients with psoriasis or with lichen planus. They don't always have every textbook nail finding, but there are, for the patients out there listening, some very, very distinct nail changes that can occur for certain skin diseases. So, those are things that your provider is going to look for. We're going to take a good overview of those nails and assess your nail health. Now, of course, Erica, as you know, that could be very challenging if the patient comes in with thick acrylic nails on or with
Their nail polish or the dip.
my teenage daughter could probably give us a lesson in all of the different nail techniques that are out there. This is a great question. Do you make your patients come in with bare nails? Like, do you make them take their manicures off? Do you make them remove polishes before you do a full nail assessment?
I feel like nails aren't always the immediate complaint that people come in with, right?
Right.
I feel like hair and nails is almost an out the door kind of, "Oh, one more thing.
Yeah, yeah.
And you're like, "This is a whole conversation, this one more thing." But I find a lot of times it's an add-on of, "While I'm here, can you also," and if you have a concern about a nail, you should definitely come in without your nail polish on.
Correct.
It's
And
so
not
hard.
just like the
Yeah.
one toenail that you're worried about,
Mhm.
because we often want to compare to the normal side. We want to see what the normal looks like and then compare that, to your affected nail. And even if you have a huge event that next day and you need to keep your nail polish on, at least bring us photos of what your normal looks like. I love, taking the time to go through patients' photos. If patients have put them into a nice little album for us ahead of time and we don't have
Yeah.
to scroll
Don't
through
have to scroll for a
30,000
couple minutes
photos,
looking for everything.
let's find that one from 2021. So when the problem first began. So make sure that if you have nail complaints, if you have hair complaints, if you have skin complaints, and you have photographic evidence of what things used to look like, put those into a really easy like iPhone album.
Not only just a face view of the nail, but also maybe the tips, the end on, so you can
Absolutely.
see, is it lifted? Is there debris underneath the nail? So
Yeah,
that would be
absolutely.
helpful as well, I think. But yeah, a lot of times I'm telling them, okay, next time you come in, I need to see it without your polish on, just
Sure.
because it is usually an add on. So
Yeah, you
you
got it.
find that too. It's an add on a lot.
Very much so. Yeah. The hand on the doorway as we are, already did the full body skin exam and already did their cancer screening and refilled all our prescriptions. And then, oh, by the way,
Too.
correct. Yeah.
Yeah. Okay, so we kind of alluded before to we might be able to know how long ago something happened with the nail. We'll have a little ridge in our nail that might be an indication that something happened, right?
Yes. Yes. So sometimes when you do see, and there's different types of lines, there's Bose lines, there's Mies lines, there's different types of either kind of changes in the kind of nail plate itself or changes in the color of the actual nail that can indicate a specific diagnosis or a specific stressor to the body that happened a number of months ago. So sometimes it can be medication. Anesthesia, if you had surgery, X number of months ago, if you had a major weight loss or weight gain. But
Yeah.
it's definitely something that, we can tell a lot about a patient by what's gone on with their nails, and the nails kinda continue to tell that story.
All right. Sometimes your body will kick out a nail.
Right.
It's like moving out. It's going away. It's like I'm going to grow a new nail. I've got places to go, right?
Right, right. So a lot of times that'll happen after trauma, right? Especially in, the podiatry world, like my both of my parents are podiatrists, my sister's a podiatrist. I actually have 6 at one time before they passed, had
That's
6 podiatrists
amazing.
in
That's
my
a lot of
family. A
podiatrists.
lot, 6 in my family. So I have, such an enormous amount of respect for the podiatric profession. If you are a patient who has a podiatrist, like, hug your podiatrist. They are the sweetest, most humble, hardworking doctors that you will find on this planet. They are just amazing. And obviously, I'm very biased, but we will oftentimes see that when you are an athlete or when your shoes might be a little bit too tight, and when those nails are kind of jammed into that shoe and there's a lot of repetitive trauma that's forcing the nail back on to the
Uh,
cuticle, a lot of times the back of the nail is going to pop up, and that will grow all the way out as a new nail comes in, and sometimes your new nail plate will kind of start to regenerate and will pop up the old nail. So almost like, a lizard kind of sheds its skin, our body will get rid of that old nail and will replace it with a new one, hopefully a healthy one. We see it more often in the toenails, but it certainly can happen on fingernails as well from
uh,
all the trauma and all the repetitive trauma that we do to it with all the nail
yeah,
tech
talking
stuff.
to you marathon runners out there.
Oh boy, for sure. So any
Downhill hike.
runners out there, any hikers out there, any kiddos that have gone through hand, foot, mouth, how often do you see
Oh
that,
yeah.
right? So oftentimes I always warn parents when I see a kid come in with hand, foot, mouth, and they have the little blisters around their little toes and around their little nails. I always say, Don't freak out, but in a few months, this baby is gonna lose multiple toenails, like, it's just par for the course, it's gonna happen." So, not everything that happens to a toenail is always fungus, right? There's so many conditions that can happen to nails, and everyone blames fungus always, and
It can look like
I
fungus, and
a lot of
that's
things can
why
look like
if
fungus.
somebody wants to take a little clipping of your toenail, let them. So
Yeah,
you
or a
don't
little
even
scraping
have that
underneath, and now we have
scraping.
wonderful testing. I don't know if you do a lot of PCR testing in your practice, but we've started to do a ton of this, which is great because we no longer have to wait like 8 weeks for a
It's
nail
so
culture.
fast.
We can
Yeah.
get a really good PCR rating as to exactly the microorganisms that are growing underneath that nail, and then we
Mhm.
can start them on the adequate and appropriate therapies because not all nail conditions are fungus. There's so
Yeah.
many yeasts and molds and bacteria and different things that can grow.
Mhm.
And I work in the South, as do you. We work in very warm, very hot, very moist environments. Moist, by the way, is one of my husband's least favorite words, so I say it as often as I can. Moist and ointment. He hates those words. And I'm like, those are words I say every day, by the way.
Yes. Unavoidable in derm.
Unavoidable. So when you work in a swamp, in a very moisture rich environment, you're going to see a lot of things like fungus
Mhm.
grow, but it may not be the only
Yeah,
commensal
people that are
organism.
wearing boots all day long or those
Ugh,
steel-toed shoes or just
absolutely.
leather that's not breathable. You've got
Yeah.
all that sweat and buildup.
Yeah.
Since we're talking about like wet and sweat and stuff like that, is, if you have a nail that turns kind of like bluish green or
Mhm.
black,
Yes.
you might think it's fungus because it makes sense that it might be mold because it's green.
Right.
But
But that
you
is
can,
often a pseudomonal nail infection, which is usually
yeah, you can also get
bacterial. Very good.
bacteria underneath there.
That's correct, that's
Mm.
correct. And sometimes it's just like a big, huge party, there's a ton of different microorganisms that are all living together and living their best life, so, we oftentimes will need some kind of specialized testing to find out exactly what microorganisms we
Yeah.
need to treat.
Sometimes I think there's a mixture or like you'll have that mixed toe web along with it too. Do you tap into using Domburo soaks ever?
Yes, I do, I love white vinegar as well, so Donborough soaks can be very helpful, vinegar and water can be very helpful, I
You ever
love
use vinegar and Listerine?
that can work as well, that can and it smells a lot better than white vinegar alone, for sure. But I love when homeopathic and old school regimens that people's great grandmother used, actually still work, and vinegar is one
I
of
feel like
those.
Vicks is making a comeback too.
Vicks
Have you been
has
hearing
made
people
a
talking about
comeback, yeah. But I feel like Vicks and duct tape will be around, like, into the next millennia, and people will be looking back in the 2000s and the 90s and say like, "Oh, the duct tape was the greatest invention that's still around."
it still is. It's never gonna go away.
For sure, for sure.
I want to go back to when you were talking about your whole family of podiatrists because
Yeah.
I feel like the podiatrists also take a lot of the thickened nails from us
Yeah.
as well and
Yeah, for sure,
dremeling the heck out of those to get
for
them
sure.
to
Yeah,
smooth.
so
So
when you get a really, really a thick nail, a nail that not only is, hardened and, can get a lot of dryness to it, but when it actually thickens up like a horse hoof, it's incredibly difficult for patients to trim their own toenails and to actually kind of do the self-care that's necessary. So, oftentimes we will need those podiatrists and their assistants to be able to take tools and Dremel down those really thickened nails. And sometimes that onychogryphosis, that really, really thick nail plate, might not be infected with fungus. It might be the fact that their nail matrix, where the nail is created, has gotten so thickened and so inflamed that it only knows how to grow a nail that's this thick instead of a nail that's
mhm.
this thick.
Yeah, and a lot of times they will still look really yellow
They can look
or
very
like you
yellow.
said and
Yeah.
not be infected. So
Yeah, so that keratin, a normal nail plate might have 100 layers of dead keratin cells. When you get those really thick plates, they can have thousands and thousands and thousands of layers. And keratin has a natural yellow hue to it. So it often will look very, very yellow only because there's not blood flow going through that nail. It's not receiving good, healthy, red blood cells and white blood cells and all the things that give skin our color, mixed with the keratin. So you're just seeing that yellowing. The roots of it and the blood flow of it and where it receives its blood flow is that bed underneath the nail. So the nail bed has to have healthy vascularity, it has to have healthy blood flow. And sometimes that can be extremely compromised if patients have like autoimmune conditions like scleroderma, or if they have diabetes or have neuropathy and problems with their nerves. You need healthy blood vessels, you need healthy nerves to have healthy nails. So sometimes when we see those problems with the nail, it may not just be the nail. It may be the patient was a smoker for the X number of years and all those little tiny capillaries way, way, way far away from the heart have died. But, again, that's just goes back to all nails tell a story.
Yeah, totally. I remember, when my son was young, I would tell him that the white spots on his nails were how many girlfriends he was gonna have someday.
Ooh,
So
you're
he'd
you're a
come
better
in like,
mother.
he'd come in and be like, "Mom, I got 3 new white spots on my nail."
3 new girlfriends.
Yeah, 3
I
new
used to tell my
girlfriends.
kiddos, "That's how many lies you've told this week."
Oh, that's a good one too.
So, yes, those little dings, those little white marks, these lines and what have you can oftentimes be from either, again, medications or trauma or a stressor that went on. Of course, after COVID, we started to see all kinds of crazy nail changes that occurred. Not only did people get like COVID toes and they could get this
Yeah,
crazy kind of reaction, but we saw tons and tons and tons of nail changes after patients had COVID. And again, with the timeline, I could usually tell people, "Oh, I could see you were really sick 3 months ago," or whatever it was. And again, people always thought like, "Yeah, do you have a crystal ball? Like, how did you know
yeah.
that?"
Are you looking into a crystal ball? That's exactly what I was just thinking. They'll come in and just a lot of times there will be color changes on the nails. So, one that people really worry about, and they should, we talk about this all the time, is whether or not you've got some dark streak. Can you get melanoma under your nail? And
Yes.
so we know it's possible that you can have a mole that's kind of streaking down the nail and it not be melanoma. What do you look for when you see a dark streak in the nail?
Absolutely. So longitudinal melanonychia are the kind of melanin streaks that often develop through the nail or down the nail plate. And usually they are very, very common in patients with darker skin tones. In fact, more than 50% of all patients with skin of color will have longitudinal melanonychia, sometimes on one nail, sometimes on multiple nails. And if they are very uniform, very symmetric, kind of the same width at the base of the nail that they are at the tip of the nail, if they kind of grow out in a nice normal pattern and look like the nice normal color all the way throughout, even if they're very, very dark, it may not be anything worrisome whatsoever. However, if you're having changes, if all of a sudden, it's kind of like almost like a pyramid shape where it's a tip at the point of your nail and it's a little skinny part of the line, and then the line gets much wider as you go back down toward the cuticle, or if that pigment goes onto your cuticle itself, that can be a big, big sign that something else is going on. So that's called Hutchinson sign, and that is typically a sign that could indicate melanoma can be growing
Mhm.
within the melanocytes that are on that nail plate. So
Yeah.
very important to make sure that you get that evaluated.
Yeah, a lot of what like we tell you to watch out for moles. Is it growing? Is it changing? Is it irregular?
Asymmetry, changing color, changing size, all of those things. But
Yep, and then
when
we'll
you
monitor. A lot of times I'll measure when I'm trying to just monitor one for somebody who's worried that maybe it might be changing.
yeah.
Then we might take a measurement of it just like we would a mole that you want us to watch as well.
Very true. But they're very difficult to remove, just like moles in our skin. We can't always get rid of the individual moles. You may not be able to get rid of that line in your nail. So that may be with you for life. That may be just your new normal nail. And it's hard to remove. but, like,
Yeah, and if we
luckily
do go in and
easy
we
to
do
fix it.
biopsy it, we might also give you some sort of ridge in your nail for the rest of your life, but
Very true.
but if it's necessary, we do need to take those biopsies. If it's not necessary, it's okay for your provider to say, "You know what? We're just gonna watch this one."
That's right. That's very true.
All right, we're just here for kind of general medical information. We're not your dermatologist, but I wanted to see if there were any general recommendations you might have for caring for your nails.
Sure. I'm so glad you asked. So of course, I love to treat nail conditions and everyone's provider is absolutely the best person to go ask about your specific nails and your specific nail conditions and treatment recommendations. But I think there are a lot of options out there now and thank goodness we have so many more options for healthy nail care. It's really important that we teach patients to do proper hygiene techniques. So, just like we teach our kiddos and our little ones and our teenagers how to care for themselves, how to properly bathe, how to properly wash their hair, no one really always sits you down and talks to you about how to properly trim your nails, how to properly care for your nails. Remember, for all the patients out there, the first rule of medicine is do no harm. So, you don't want to do your own home surgery. That's never a good idea. Try to always cut your nails directly across. If you feel like you have an ingrown, if you have a hangnail, if you have something that is really sore, really uncomfortable, go see a medical provider and make sure that that's not infected and make sure that they can help you surgically get that out with actually autoclaved instruments and sterile instruments that will not introduce more infection or more problems.
Yeah.
But as far as natural nail care, I have been incredibly blessed to have been associated with a wonderful company called Hydronail. And Hydronail is a company that started with the idea of we need a solution for dry, damaged, or brittle nails. And they came up with a solution that's pretty brilliant. They came up with a patch that patients can wear overnight or for multiple hours. And they're basically like face masks for your nails. So they come in these wonderful little packs of 10 or packs of 4 strips where you can decide, hey, I'm going to need to treat all 10 nails for at least 10 days. My nails are wrecked. If you've just taken off acrylic nails, if you just removed your gel nails and they are just decimated and so dry and so, so sad, you can actually buy those hydro nail patches and they come in these individually wrapped packages and you can open them up and apply them to your natural nails. Even if you never take off acrylic nails or you never take off gel nails, you can still apply your hydronail patches. Essentially, it's going to create a nice little hydration patch that is going to stay on your nail and stay completely mess free on your nail for all night or for multiple hours at a time. You can still pick up your phone and you can still text, you can still do things, you can cook, you can do everything with these little nail patch
You
on.
don't have messy, like, cuticle oil
Correct. You don't
on your
have
hands.
cuticle oil.
It is really genius. I put them on last night and I did cover because I do have nail polish on. So I put it up a little tiny bit higher to benefit from that hydration, a little
Yeah.
tiny bit above my cuticle.
Yeah.
And
And
it
if
was
you
fabulous. They stayed on all night long.
I used to bartend in college and would get like the bar rot on my nails and I would get like terrible cuticle problems. And of course, these won't fight infection. They're not going to treat a paronychia. But if you do have a lot of dry cuticles, you can kind of again move that nail patch down a little bit to where it's even helping with the dry, kind of rough, damaged cuticles. And nails, although the adornment of nails has been very popular, there's not a lot of products that are out there to repair, hydrate, and
A
help
lot of what we're doing is
that
actively breaking down our nails and being
very
mean to
much.
our nails, not necessarily being nice to them. So
Very true. A lot of
before we close, now I'm going to do a fun little lightning round with you. You just tell me which one you prefer, fake or natural.
natural. My girls will be terribly embarrassed that I said that because they are all into the nails.
Yes. Now,
They love their Pinterest posts with all their nails that they want to plan out for every month of the year. But I personally, in the medical profession, have always loved natural nails.
so with your daughters then, if you had to pick for them, would it be gel, acrylic, or dip?
I would say that I prefer LED cured gel. So
Okay.
LED is one of the different types of lights. There's different light boxes that you can stick your fingers into to get these nail solutions to harden. And I would say go for the one that is LED light, not UV light.
Mhm.
You and I have now seen the repercussions of decades of women
Yes.
that did the UV gel nails and are now growing tons of squamous cell skin cancers on their
Mhm.
fingers. So
Yeah, worth asking your nail salon.
LED or UV. That's correct.
Okay, cuticle oil, yes or no?
One, I think cuticle oil is very messy and it gets everywhere. And then you try to wash it off your fingertips and it washes off your nails, number one. And we discussed earlier that nails are hydrophilic, which I know is a big word, but hydrophilic means loving water. What is the opposite of water?
Uh-huh.
Oil, right? So,
Mhm.
oil although, oil can be great for our skin, it's actually not gonna penetrate a nail plate.
Mhm.
Nail plates are hydrophilic. They want water and they want water-based hydration and hydrohydration, not oil-based hydration. Oil
Love
will
it.
not
Love
penetrate.
it. Your oil's just making your cuticle not look dry.
Correct. Your oil will make your cuticle not look dry temporarily, but hydration is what your nail plate is really desperate for.
All right, most Googled nail condition, would you say?
Ooh, okay, so in podiatry world, I would say absolutely ingrown toenail, 100%, or fungal nail. That might be a toss-up, but ingrown nail or fungal nail, are probably the most common for toes. For fingers, probably longitudinal melanonychia.
Mhm.
But I don't know, we'll have to ask our friend ChatGPT what's the most Googled.
Yes, they know more. Okay, what do you think is the nail condition that most people ignore?
I really think most people avoid and ignore dry, brittle nails because if your skin is dry and your hair is dry and your nails are dry, most patients will address the hair and the skin before they address those poor little nails. But as our skin and hair dry out, so does our nail plate. And so, these nail plates are desperate for hydration. So, I do believe the onychoschisia and onychorexis, which are nail dryness and splitting and rigidity and the ridges and the dry skin conditions that occur on our nails are the most neglected.
Mhm. Do you have a nail myth that you think needs to go?
Ooh, I love dispelling myths. Let's see. I think we just need to teach this new generation that not all nails need to be covered and painted always. That natural can be beautiful and that they don't have to spend hundreds of dollars at a nail salon every 2 weeks to have beautiful nails and that they may look back on this time in their life and unfortunately regret the damage that they're doing now to their nail plates. So I think the nail myth that nails have to look picture perfect in your Instagram posts and in your TikTok videos and that your nails always have to be done, that's a myth that you're going to really regret later in your life.
I'm gonna add one to that, which is the pushing and cutting of your cuticles.
Yes, good call. Good call. Yeah. They don't need to be pushed back, not all trees need to be trimmed. Our cuticle will actually kind of naturally grow out and cover a little bit of that lunula, a little bit of that white half moon that you see at the base of your nail. And if you're looking at your nail right now and then taking a look to see if your cuticle has gone out there, it's okay if it has. You don't need to shove it back because that might do more damage.
We need it for the health of our nail. It's there for a reason.
Very true.
All right, and then one last one. What do you think patients should not ignore if they see this thing with their nails? What should they not ignore?
Signs of infection. and signs of skin cancer or melanoma. So I always tell patients, you know your body better than anyone. If something just does not look right, get it checked out. And if you go to an urgent care or if you go somewhere to primary care and they're like, I don't know what that is, then find another opinion, like seek out answers. If you have a bad feeling that something is happening with your nails, go get it checked. And then, of course, signs of skin cancer. I have had older patients that thought they had a wart that just wouldn't go away and went on for 30 years, 20 years. And lo and behold, it was a squamous cell carcinoma the entire time. And it was never a wart. So when you have a bad feeling and you've been told, oh, no, it's fine, it's just a benign whatever, but you don't feel right about it, trust your gut.
Yeah. I had a gentleman who told me, "No, my nail's been black for a really long time. It's been seen so many times. It's fine. Actually, in fact, it's been biopsied before and it was fine." And I
Oof.
was like, "Sir, I love that you had it biopsied before, but it's getting biopsied again today." And
Yeah.
now he's missing the end of his thumb.
Yeah. From
So,
melanoma,
mhm,
most likely, right?
mhm. Yep.
Yeah.
It's melanoma.
Yeah, so again, things change and bodies do change, but when things change in a negative way or when they change in a way that doesn't look normal to you and doesn't look like your other nails, definitely get it checked out.
I think we could really probably just talk for another hour.
I know. I love discussing skin conditions, nail conditions, and some really awesome, very easy to access remedies, for these very common nail conditions. So, Erica, thank you for having me on your awesome podcast. I hope we reach so many patients and I hope that people listen in and can learn a little bit about their nails and can take a deep dive into nail health. There's so much information out there. So take the time to learn about your nails and your conditions. And thank you for bringing this information to all the patients out there.
Thank you. I think a lot of people are now on this self-care mission, so I think a lot of people will listen and look into this. But thanks for sharing your expertise and walking us through the language of nails. We
Really?
do know now that our nails are absolutely speaking to us. Shannon, thank you so much for joining me and helping us decode what our nails are trying to tell us. From ridges and color changes to infections and the occasional red flag, our nails really do leave clues right at our fingertips. This has been Derm Clarity, Poor Decisions, and Flake News. If you enjoyed this episode, don't forget to continue to listen, like, follow, and share. And I'd love to hear from you in the comments. Tell us what nail changes you noticed before, or what's something about your nails you've always worried about. Your questions might become a future episode. Remember, most nail changes are harmless, but they can sometimes reflect what's happening inside the body, which is why paying attention matters. Thanks for listening, and we'll see you next time on Derm Clarity.